Welcome to today's Include NYC online webinar. We're very happy to have today with us Madeline Maldonado. She is a licensed clinical social worker with the Early Intervention Program. My name is Robert Carabay. I am an operations associate, data management at Include NYC. I am here to provide support if you have any questions, any technical questions about Zoom. You can type them into the chat and I will do my best to help you. I'm now going to turn it over to Madeline Maldonado, but I will put our contact information in the chat box. So Madeline, thank you for joining us.
Good afternoon, everyone. I'm Madeline Maldonado, and I am a licensed clinical social worker, and I am contracted with the New York City Early Intervention Program to do evaluations. So I'd like to talk to you today about something that I'm very familiar with, which is remote early intervention evaluations. And I specifically want to talk about the advantages. In other words, why remote early intervention evaluations versus the home-based early intervention evaluation. So I'm just going to advance to the next slide for those of you that are following along. From computer. Okay, so the New York State an educational program for children ages 0 to 3. It is funded by the New York State Department of Health. If you suspect that your child or any child that you are familiar with has delays, developmental delays, an evaluation is the next step. Now, evaluations can typically be done for children that are birth, so age 0, all the way to 2 years and 11 months. Any older than that, and we cannot accept the child only because they age out at 36 months. In March 2020, telehealth evaluations and therapy services were mandated to reduce the spread of COVID-19. So we went from being a home-based program to being a remote program while New York was in the state of emergency and quarantine. Now, home-based services were allowed to resume in July of 2020, but in order to ensure that we continue to reduce the spread of COVID-19, teletherapy is still the preferred mode of service delivery. So that means that when you call and ask for evaluations with the early intervention program, teletherapy evaluations will still be the recommended type of service. So, some of the advantages that we have found to the remote evaluation. Research shows or tells me this effect as evaluation. The evaluator is also able to observe your child in their natural environment. Sometimes when children go to offices, they behave differently, whether because they're anxious, it's not a comfortable setting for them, or some children freeze. They're just not comfortable around strangers or around people that they think are doctors or nurses. And so if you have to bring your child to an office, the person evaluating the child may not get the full picture. In the same way, sometimes when an evaluator goes to a home, a child can also freeze or become anxious because there's a strange person coming into their environment. It's happened to me many times. So I have found that that's something that doesn't happen on video because the child can see you and they know you're there, but they're not afraid or anxious because you're not actually physically in their home. Another advantage that we have found is that there's no barriers around finding providers who can actually do the evaluations. One of the things that we always had to bear in mind when the program was only home-based, evaluators who went to certain communities. For example, I live in Westchester County, and if I was to get a referral for Brooklyn, as much as I would want to see that child, I can't travel to Brooklyn to do an evaluation. It's just too far. And we all know about Brooklyn traffic, right? So now I can see a child who lives in Brooklyn because I can just do it on video. I've seen children in Brooklyn, Staten Island, Far Rockaway, and Upper Westchester County. And these are all places that I was not physically able to go to before teletherapy started due to the COVID-19 pandemic. Another advantage that we have found is that there's greater scheduling flexibility. So before, sometimes a parent would need an evening appointment or a Sunday appointment or a Saturday appointment. And it was difficult to schedule these appointments because we all have families too. And so at 7 at night, that's usually dinner time in most people's homes or a lot of people's homes. But now, because an evaluation is remote, you can find an evaluator who will say, okay, I can do an evaluation at 7 o'clock or maybe 7 in the morning, because it's not so difficult to do an evaluation at 7 in the morning when you don't have to wake up at 5 and get in your car and drive somewhere. So we're finding that there's more access and it's easier to find providers who can meet the parent's schedule without having to, negotiate and figure out a better time. Another advantage is that it's really easy to request a remote evaluation. The only thing that's required is a consent form that says that the parent is consenting to the telehealth or teletherapy evaluation. Now, you have the other consents that have been part of the early intervention program. Only one form that has to be filled out and signed by the parent in order to get a telehealth or teletherapy evaluation. More advantages. So we're going to the next screen. So something else that we really have found is really convenient is that remote evaluations can be done outside the home if needed. For example, this summer, I had parents that were telling me that they were out of the country with the child for 2 weeks, and they would be back, but they didn't want to have to wait till they were back in their home in the United States in order to do the evaluation. So I've done evaluations where the family has been, let's say in Mexico, or been in the Dominican Republic, or in Puerto Rico. I've also done evaluations where the family went to visit grandma or grandpa in South Carolina or in Florida. And we've been able to still do all of the evaluations and continue the process so that by the time the family comes back to their home in New York, we're ready to move forward and start the therapies. We also can of course do the evaluation at another family member's house. So, I've had families that because of the pandemic, they're staying at a different home than their usual home. So they might be staying with a parent or a grandparent, and we could do the evaluation there. So it opens up the location to almost anywhere that's possible, as long as you have a device that has access to Wi-Fi and some kind of video app. Which brings me to the next point. Remote evaluations can be done using any app. So the parent can basically choose. I know that the evaluators tend to prefer Zoom, but we can use FaceTime, we can do WhatsApp, Duo, whatever video app the parent prefers, as long as we can download it on our phone or computer, we can use it as well. And the parent doesn't have to have any experience with video calls. If the parent really doesn't know how to use a video app, the evaluator will work with them and they will ensure that they can navigate the app, and they also will help them pick out a place in their home to do the evaluation. So an example of this, prior to my evaluation, I do a quick phone call with the parent. I go over what kinds of apps they feel comfortable using. For example, if I suggest Zoom, I ask them if they've ever used Zoom. Are they comfortable with Zoom? Do they need any help practicing how to use Zoom? And we cover that. And then I also ask the parent, where would they like to do the evaluation? So if they say, my home, I say, okay, can we take a look at where you would want to do the evaluation. So let's look at the room. Let's do a test video with the lighting to see, if you need to make the room brighter, or let's see where you could put the phone or the tablet in the room so that I can see you and the baby. And the parent can also show me at that point in time anything that they feel could be a barrier. Like, for example, the parent may say, I don't really have a lot of space, or, I have a lot of furniture blocking. And we could figure out the best way to position the phone or the tablet in order to do the call. Another advantage is that there are no special toys that are needed. I always get asked this question, do I need special toys? You don't need any special toys. Basically, any toys that the parent has in the home can be used to do a remote evaluation. And in the circumstance that the parent doesn't have access to toys for whatever reason possible, or they have very few toys, we can even use everyday objects. I've done evaluations using a plastic cup, spoon, a plastic bowl, a blanket, and a hair comb. And I think I had a lip balm. And I've been able to do an evaluation to test how the baby's development is using just these everyday household items. So this is another significant advantage to remote evaluation. And then the biggest thing I think to bear in mind is by using teletherapy and remote evaluations, we're stopping the spread of COVID-19 or slowing it down without having to follow the strict COVID-19 protocols. Now, you may be asking, what protocols are those? I want to talk about that in a second. So we are allowed to start going back in the home. Like I mentioned in the prior slide, as of July, the New York State Department of Health allowed home-based evaluations and services to resume, but they require that the parent has to follow certain protocols, and so does the evaluator. So we're going to go over those now. So for in-person evaluations, if the parent prefers an in-person evaluation in the home, they have to agree to these specific conditions, or if they can't those conditions, they just have to wait until the COVID-19 restrictions end, which could be months from now, to be perfectly transparent. As all of you are aware on the news, New York is seeing an increase in COVID-19 positive cases in the last 2 weeks. So we do not know when the restrictions are going to end. Essentially, the restrictions would likely end when New York and the surrounding states are no longer under risk of a COVID-19 pandemic, the way that we were a few months ago, where so many people were hospitalized or passing away every day. So this could realistically be months, or it could be after a vaccine is developed. So I don't have an answer as to when it could cease. And the thing to bear in mind is that the child can only be evaluated until they're 2 years and 11 months. So if we wait for the COVID-19 restrictions to end, the child could either lose a lot of months where they won't have a lot of time left to participate in the program, or the child may actually age out before they're able to be evaluated. So they would end up being 3 years old and wouldn't be eligible to be evaluated by early intervention. So the restrictions that the parent would have to agree to are the following. First and foremost, the parent would have to sign what's called the New York City Early Intervention Consent to initiate or resume in-person services during COVID-19. This is the actual name of the consent form, and the parent would sign it indicating that they are agreeing to these conditions. The conditions are that everyone who's going to be in the session or around the therapist and parent and child has to wear a mask at all times. So that means that if the parent and child are working in the living room with the therapist and home or a grandmother comes to visit, they have to wear masks the whole time that the therapist is in that home. if a mommy and daddy have an older child that is in school or somewhere else, and that child comes home, they have to wear COVID mask at all times that they are around the evaluator and the parent and the child. The parent also has to agree to keep other people in the home that are not participating in the session at least 6 feet away. And I do know that based on the size of most apartments in New York, that can be very difficult. So that means that if the parent and the child and the therapist are working, let's say in the living room, anyone else who comes in has to be at least 6 feet away. So they may not be able to sit at the sofa or at the dining table with you, or sit in close proximity. They may have to realistically be in another room. Another requirement is that everyone participating in the session has to wash their hands immediately before starting and immediately after starting. For the evaluators, we are told that the moment we walk into the home, we must ask to use either the kitchen sink or the bathroom sink and wash our hands with soap and water. And another requirement is that any services that are scheduled, any evaluations that are scheduled, have to be canceled and rescheduled for 14 days later if anyone in the home is sick. And that doesn't mean sick with COVID-19. That means if anyone is sick with diarrhea, vomiting, a cold, a cough, a fever, anything, sick with anything, the service has to be canceled and rescheduled for 14 days because we don't know if the person who's sick in the home could possibly have COVID-19 and hasn't been tested yet. So I know that this is very inconvenient, but this is the requirement. And then the last requirement is that the parent has to provide the toys. The therapists and evaluators are not allowed to bring any toys at this time. They cannot bring any materials into the home except for a paper and a pen. So they cannot bring a laptop, they cannot bring a handbag, they cannot bring toys, food, anything into the home. So the parent would be responsible for providing the toys and also for ensuring that the toys are disinfected. So either that means the parent would spray the toys with some kind of bleach or bleach alternative solution that kills germs, or they would spray it with Lysol or alcohol. The parent, whatever the parent uses to clean would have to be used to clean toys. And that is part of what they're being to as one of the conditions for the in-person evaluation. So I know this is a lot, but there are some people that still do in-person evaluation. I think that what's important is that everyone know the benefits of the remote evaluations and also know that you can do in person, but you have to follow these conditions. And you can make the best decision for you and your child and your family. So at this point in time, I'm going to open up the floor for So I see some questions here. Anyone have questions? Okay.
Sorry.
Yes. Do we have questions?
There's one question that was submitted. Says, my grandson was receiving speech therapy and they stopped the service now that he is attending a pre-K program at a public school. How can he continue to receive speech therapy?
How old is the child?
It doesn't say. It was submitted through the Q&A. Yeah.
Okay. If this is a child who is already over the age of 3 and needs speech therapy, there's a couple of ways to go about it. One way is if the child is enrolled in the CPSE preschool program with the Board of Education, then the parent can ask for that child to be evaluated for speech and possibly to have the speech provided in the preschool program or in the home. if no one is available to do the speech during the school hours. If the child is not in the preschool program, then the next step would be to apply for the preschool program, which can be done by filling out an application with any Department of Education borough office. Like, for example, I know that the one in the Bronx is located at, I think it's Fordham Plaza. If you go to Fordham Plaza, you can get an application and apply for the preschool program for age 3 to 5. And they do provide speech services for children. Of course, the other option is you can ask for speech therapy through your insurance. So you can contact your medical insurance with the 1-800 number on the back of the card, and you could ask them to give you the names of speech therapists that are providing services. Now, most speech therapists that are through insurance are not going to be doing home-based speech therapy, but they will do speech therapy at a center or at a clinic where you can take your child. If we're talking about a young child, younger than age 3, so they would be eligible for early intervention, then all you have to do is call 311 and you can request for a referral to be made to the early intervention program, and they will connect you to an agency that will take the referral, and you can inform them that you're interested in a speech evaluation for your grandchild. So I hope that answered the question. If not, just please raise your hand or add another question in the chat so I can continue answering the question.
Sorry, there's another comment in the Q&A. A 3K is the new program for 3-year-old. Thank you, Sonia, for providing that information. And so she says she can tell the teacher
Sonia.
she wants a speech evaluation. Do you know more about that program?
Yeah. I am not very familiar with the 3 program since it is new, and typically early intervention doesn't, we don't work for multiple programs at the same time. So I'm not too familiar with the 3K program. I'm not.
Not seeing any other questions. If anybody has comments or questions.
Yeah. If anybody has comments or feedback that they'd like to share, I'm happy to discuss. Or for those of you that I saw in the poll that have had evaluations before for your children or family members, if you want to just share any feedback about that, if you have had a chance to have a remote telehealth evaluation, I'd love to hear your feedback.
We have a shy audience today.
No one feels like talking.
We have a question in the Q&A. What if a child is crying during the remote evaluation?
Okay. That's a really good question. Children crying is something that we're pretty used to. We see children crying when we were doing home-based, and it's not any different. They're gonna cry during remote evaluations as well. What we usually tell parents to do is to just try whatever normally helps to calm down the child, and we can wait. So if a child is crying, mommy says, I want to go get a bottle, go get a bottle. I'll wait. Or I'm going to give the child some water and, bounce them around while I walk with them. That's perfectly fine. Sometimes we don't even have to wait. We can just keep talking and having a conversation about the parent's concerns while they're calming the child down. So crying is okay. I've been asked also, what if my child is really active and won't sit? And that's where I'll say to the parent, if you have a choice, use a laptop. I'm sorry, if you have a choice between using a laptop or a phone or a tablet, I say do the phone or tablet because children move around. So the phone or the tablet is pretty easy. Just to give an example, this is my phone. I could walk around and follow you with it if you're running around or walking around the home, whereas carrying a laptop to try to catch the child's movements can be harder. But if a child moves around, if a child cries, if they have temper tantrums, all of that is part of their natural behavior. And we want to see those things. So it doesn't stop the evaluation from taking place and being able to be completed. Now, if a child is crying and is too upset to continue, they're having a meltdown where the parent cannot get them to calm down after, 10 minutes, then I always offer parents the choice, do you want to reschedule and kind of do a part two, maybe tomorrow, maybe the day after? Let's pick a different time of day. Maybe the baby will be different and more calm. So we'll work with the parents, and we never make the parent feel that the evaluation can't be completed just because the child had tantrums or was crying.
Great question. Another one somewhat related to that is my son is usually shy when put on a video call. How is that handled?
Well, we usually try to allow the child a few minutes to warm up. One of the things that we do is we try to be natural. So I'll tell the parents, sit and talk to me like you would a friend. Don't make a big deal out of, this evaluation so that the child kind of knows that something is happening. So if you normally talk to your friends on FaceTime or WhatsApp, just relax. Sit on your sofa like you normally do and let the child warm up. So if I see the child, comes to the phone and gets this, then I'll say hi and just smile and try to engage with them. If the child really doesn't want to engage with me, then I give the child their space and I keep talking to the mom or letting the mom do what she's doing with the child, and then I'll try again. Sometimes I'll try to figure out what the child likes, and I'll give you a live example. One of the things I do is I have toys, so I'll drive a car across the screen or do this to try to engage the child and make silly sounds. Or I'll hold up, look at the doggy, woof, 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 look at the doggy. And sometimes that gets the child to warm up. Or the mom will say, well, he doesn't like dogs, but he loves cats. Meow, meow, look at the kitty. And sometimes if the parent says to me, oh my God, he loves real animals, cats and dogs, I'm very lucky that I have one of each. So I have been known to pick up my dog, hold him to the screen and have him pretend to wave his paw and say hi to the child. And that usually will work even with the shyest child, because they'll see that I'm trying very hard to engage with them. And I've seen similar tactics used by my other colleagues. We all try these tips and tricks to get the child to engage with us. We've shared videos to the screen of like Baby Shark or singing the ABCs, and we'll do the dances with them just to get them to feel comfortable and engage. So shy kids, we have something for them too. Yes, Stephanie, your son loves Baby Shark, anything with music, yeah. I had a child the other day that the mother said that he loved bachata. bachata music and Romeo Santos, the artist. So I said, if I have to put some bachata on the screen and sing along, we're gonna do that. I'll do anything to try to get a child to connect. So we're not above looking silly, putting on silly hats. Yes, whatever works. We're trying to get the child to connect with us.
Another question, how can I best prepare my child for a virtual evaluation, i.e. time, what we'll do? What questions should I be prepared to answer about my child?
That's a really great question. So I'm going to start with the last part. In terms of questions, the most important thing is to try to remember the developmental milestones. So, try to figure out if, for example, you say your child has a speech delay or that your child has started to lose words, try to see if you can remember how old the child was when this started happening, when you started noticing. It's helpful if you write down the words that the child can say, or if they've lost words, the words that they were saying before. Because sometimes, when a parent is being asked during an evaluation, they'll forget. They'll say, oh my gosh, I know he was saying 10 words. I can only remember 4. So write them down. I also think if you see your child, I don't know, having tantrums, write down what was provoking the tantrum. Or if you could even take a quick video with your phone, that will help the evaluator have an idea of what you mean when you say, oh, my child has bad tantrums, or my child screams and yells. If you could catch a short video of your child doing this, it would be helpful because you could actually show that video to the evaluator or send it to them in an email or in a text message after the evaluation. In terms of other information, if your child has a medical condition or is taking medicines, you should have a list of whatever medications they have. And you should also know the name of the child's condition. And I know some of these conditions can be really long or strange sounding, but anything that you have, so a report from a doctor that you can, show on the screen or take a picture of the form and send it to the evaluator, that's helpful. If you also have the information to a daycare or babysitter who helps you with the child and you want us to talk to that person, that's helpful to have their information so that we can call that person after the evaluation. Other than that, there's no special questions. I mean, most of the time what we do is just ask the parents, what are you concerned about? What are you noticing in your child that has caused you to want an evaluation? And most parents are able to say exactly what it is that has them worried. And then we continue to ask questions from there. In terms of preparing the child, you don't really have to prepare them with anything in particular. Like I said, I like to see children as natural as possible. And so what I tell the parents is, you're just going to ask the baby to play with you. So the child should be used to mommy and daddy attempting to play with them. And so the parent is going to have some toys set aside, whatever toys were identified during about the pre-evaluation call with the evaluator. You could just have those same toys on the floor or at a toddler table, ready to go. And come play with mommy or play with daddy. And you're gonna sit with your child and play. The evaluator is going to prompt the parent regarding what to do. So for example, I might say to the mommy, roll the car and make engine sounds, go vroom, vroom, and then tell the baby to do it. And then the parent will do that. Or I'll say, mommy, daddy, do peekaboo with the baby, or do head, shoulder, knees, and toes, and have the baby do it. And I'll just watch that. So there doesn't need to be any special preparation in terms of telling the child, that something's going to be happening. Mommy and daddy can just say hi to my friend. She wants to see you. She wants to play with mommy and you. And that's really what it is. You know, most of us will just behave like we're a friend and watch and talk to the baby and the parent as if nothing special is going on, which in a way is what makes the remote evaluations work, because the child can relax. They don't usually figure out that anything is happening because the parent is just talking on the phone, or the phone is propped up on the side and we're watching quietly while the child plays with mommy and daddy.
That's great. One other question we have is, do you think telehealth will remain after COVID-19 due to the advantages you've highlighted?
I think it's a strong possibility. One of the things that has helped is that the families have been so open to it and have given such positive feedback after the evaluations, so that we know it's working. I know that a lot of the parents have reached out to the agencies or to their service coordinator, which is the person that is in charge of their case at the agency, and given them feedback regarding this was easy, this was fast, I didn't have to wait, I didn't have to, you know, completely turn my schedule around to make the evaluation happen. You know, I called today and a week later, the whole process was wrapped up, or 2 weeks later. And so for parents, that's a really big deal, especially parents that have been through the process before when it was home-based, and they have said, you know, I had to change my schedule or go to work late or come home early, or you know, do all kinds of things with my other child to make sure that I would be able to do the evaluation. With the remote, that doesn't seem to be an issue. So because of the positive feedback, I do think that there is a strong possibility that this could continue and at least be an option, so that a parent could always say, okay, if there isn't someone who can do an in-person evaluation, I would accept the teletherapy evaluation. Um, Overall, just you know, for those of you that don't know, in the world of medicine and also social work and psychology, they also have been doing teletherapy now for, well, longer than COVID. I know about 4 years ago, they started testing out video therapy for doctors to meet with patients and for therapists to meet with their clients, for people that lived in communities that were not close to hospitals or clinics or things like that. And so they've been finding that it's really effective. So teletherapy and telehealth is not new. And remote evaluations are not new. They've been around a long time. They're just new to the world of early intervention.
I think we've answered all the questions.
Oh, that's
Anybody
wonderful.
else has comments?
I see some of these lovely comments. Yes, propuesta indecente. That is, Stephanie, that's my song. I never saw that as a song to put the baby to sleep to, but I love it. Oh my gosh, this is great. I love the comments. And I see requests for materials. I know that that will be taken care of, right?
Yes,
Okay. Okay.
absolutely.
Okay. And thank you for the compliments, for those of you that are saying you've enjoyed the presentation. I appreciate that very much. Thank you. And if I could just request for everyone who's been here, if you could just share the info. You know, the biggest thing that I find that stops children from being referred to early intervention is the lack of information. There are, believe it or not, a lot of parents who just don't know that we're here, that we're available, and that we're free. And there's also a lot of parents who have this idea that they have to go through their pediatrician in order to get an evaluation. So I just want to make sure that we all spread the word. You can self-refer your child to early intervention. So if a parent takes their child to see their pediatrician and the pediatrician is like, well, I don't know, he's a boy, boys develop late, give him time, and the mom and the dad do not agree with that, they can easily just call 311 and say, we would like an evaluation for our child. You don't have to be referred by anyone. Your parent can refer themselves. So please spread the word so that people use this service. Believe it or not, early intervention is underutilized. It always has been. Even pre-COVID, a vast majority of children that could use early intervention are referred later. They're not referred when the parent first starts noticing that there's a delay or they have a concern. And that's because the parents think that they have to go through a difficult process to get an evaluation, or that they have to see the pediatrician, which, you know, sometimes waiting for that pediatrician appointment could take a month or two. So you can call 311 yourself and just do it. It's very, very easy, okay? And thank you, Mary, that you're gonna be sharing. Thank you, Annette. Yes, Melissa, you're welcome. I appreciate that. Thank you for everyone else for your kind comments.